the person that's walking away, Len Mel. Len Mel, come on up. Len's a brother who I met in the CUNY student movement in the mid-90s. We were struggling to keep the university open. And he's here today, struggling to keep our health care. Len.
Okay. Hello, yes. First of all, it's important for people to do this. It's important to get momentum. It's important to realize this is a crisis that is overdue, that is getting worse, and we are going to build a movement, and a movement that uses our minds and uses the streets and says no, in no uncertain way, that we are a country in which when people are ill, we take care of them. We do not let people profit on their blood, their sickness, and their misery. We have people caring for each other. And that is what we're trying to do. And what we see now is an attempt to take HIP and GHI, privatize them, make huge profits, and that money and those premiums are going to come out of workers and the reduced benefits, and people are going to get sick, and people are going to die. And that is not something the people who fight for this country, the people who work for this country are going to put up with anymore. So we say no to this merger. Thank you.
Woo! All right. Eric Dinallo!
Just say no!
Eric Dinallo!
Just say no!
Eric Dinallo!
Just say no!
Who's afraid of a little rain? Not us, obviously, right? How about one from Argentina? In Argentina, they marched to remove the president, and the rain began, and it was pouring rain. And in the square, they chanted, "It rains, and still we stay. It rains,
and still we stay.
it rains,
And still we stay.
it rains,
And still we stay.
Healthcare is a right.
Fight, fight, fight.
Healthcare is our right.
Fight, fight, fight.
Healthcare is our right.
Fight, fight, fight.
Folks, we're standing in the only industrialized country in the world without a single-payer health insurance plan. We need one. In fact, we're already paying for one. The amount of money spent on healthcare is enough to cover every human being. And by every human being, I mean every person who is breathing or can be resuscitated can be covered under a single-payer healthcare system. There's a bill called HR 676. And when I mean everyone, I mean everyone. Even the brothers and sisters who are immigrants here, folks without papers, will be covered under HR 676. That's the system we want. That's the system we need. We're here today to defend the little gains that we have, to defend GHI and HIP, to stop the privatization of GHI and HIP. But we want much more than that. We want a healthcare system where everyone's in and no one's out. So next up, we'll hear from Marty Goodman again from TWU Local 100. Marty, let's hear it for him. And everyone's better the second time, you know that.
Hello again. I'm very proud to be here with you today. As a transit worker, and transit workers have gone through a lot with health care. And we've got a first-time weekly deduction from our pay for health care. And that's the first time for public workers in this city. And it's going to get worse. If the criminals in this building and Mr. Dinallo allow this for-profit merger to go through, we are all going to be paying through the nose. And we are all in this together. 93% of all public workers are covered by HIP, GHI. HIP has got assets of over $900 million. This is a big deal, people, and the sharks are circling in the water for this hit. And the hit is going to be on us, as it is again and again and again whenever there's a budget crunch, and especially when there's privatization. Privatization is destroying healthcare in this country. Corporations are driving us down, down, and down. Since 2000, premiums have gone up an average of 9% every year. Can you imagine Who in this crowd has gotten a raise of 9% each year? None of us. We're being beaten down, and we're going to be thrown into the streets without health care if we allow this sort of attack to continue. Now, I'm urging everybody to go back into their union, back into their neighborhoods, and spread the word. We've got a big audience out there, and the word is just starting to get out. And I'm afraid maybe the press was a little afraid to be here today also. I'll tell you something. We can't allow that to discourage us. We can't allow the rain to discourage us. We are in the right, and we are going to win this struggle. Healthcare is a right. Fight, fight, fight. Healthcare is a right. Fight, fight, fight. Healthcare is a right. Fight, fight, fight. Thank you.
Eric Dinello! Eric Dinello! Eric Dinello! Folks, we have a follow-up plan also on Monday. We're asking people to call in to the Superintendent of Insurance. Call in, email in, fax in, become annoying. Let them know that many people are opposed to this privatization, this so-called conversion. On Friday of next week, we're having another organizing meeting of the Coalition Against Privatization. To participate in the coalition, you only have to agree to two things. One, you oppose the privatization of GHI and HIP, and two, you believe that healthcare is a human right. That's the only qualifications to participate in this movement. And it's going to be a different kind of movement also. It's a movement that includes communities. Last night I had my child, she's 3 years old. She was at the meeting. It was a little bit late. It was that she was up till 12:30, a little cranky this morning. But that's the kind of movement that we're building. A movement based in the community that brings everyone together. So next up, we're going to hear from Jeff Gold, New York Metro Healthcare for All. Let's hear it for him.
Buttons in here. Can you hear me? Great. Thank you all. Be quick. We're all outside the ugly buildings that all these profits are helping keep going. They look like the boxes at the nice Art Deco buildings, you know, painted. I've heard the Healthcare for All campaign, the Community Labor Coalition for Universal Health Coverage. We started with this movement when we tried to stop the privatization of Empire Blue Cross, working with our brothers and sisters at Consumers Union, Consumers Report in California, to do the same thing there. We've been working with you on this GHI outrage. We're going to win this war, ultimately, because universal health coverage is a moral necessity, and the public is starting to get it. We intervene in all these hearings. We'll be with you as you go forward. And we invite you next week to our event at Judson Church. You'll get it on the email with Steve Max, great community organizer, Naomi Zatterer of the Nursing Union, Nick Godfrey, the Health Committee Chair, who's worked with us to try and stop this, and to try and actually get a transparent system. We don't even have rate setting anymore in New York State. So I want to thank you all for doing this. Thank the organizers. Healthcare for people, not for profit.